Let's finish up with the medical care, which we talked about at the end of last class. There are some interesting things to say. So some argue that universal health care is inefficient. There are certainly arguments made to that effect by many people. Individuals have the right to choose their health care provider. That's probably one of the biggest, right? They say, well, I want to have a choice of a doctor or something. That doesn't necessarily contradict the universal health care. It's just that, of course, when the system changes, some doctors may opt out, but that's because of the way we have it set up, so that there are different networks, and then if you are not in one network, your doctor may no longer be serving this network. That obviously is a very inefficient way of doing it, and it creates a mess for doctors too, by the way. I don't know if you guys are aware, they have to hire people who actually track all this stuff and make sure that the insurance gets billed correctly and all that, and that's of course a huge waste. The person is not taking care of anybody and yet gets paid just to take care of insurance claims. John Davis Lewis is one of the people who argues that universal health care will infringe on the rights of doctors and healthcare institutions. I guess forcing doctors to take care of the patients. Although, isn't Hippocratic Oath already tells us that they have to take care of the patients? Yeah, but many people who believe in like this completely unrestrained freedom do advocate against healthcare. So there's basically three approaches. That's a nice table you can see in the book. One of them is this free market approach, which says nobody has a right for health care, no obligation to provide health care. Rights understood negatively as protections against interference and no positive right. So even though negative rights are protected, there's no positive right for health care. Libertarians focus on negative rights, and consequentialists focus on efficiencies of the market. So if it's government provided, it's inefficient. If it is free market, then it is efficient. Well, like I mentioned last time, especially with healthcare, there's definitely a lot of problems when it comes to free market. There is a lot of reasons why maybe not any, but most economists will tell you that is very, very problematic. One of the most important features which necessary for free market to work is complete transparency, full knowledge of everything before you make a decision, right? Do we have transparency when it comes to healthcare? Like for one thing with prices, do you always know how much everybody charges? No, it's like as intransparent as it can possibly be. In fact, they point blank do not tell you how much it will cost, and you only find out when you get the bill. Very rarely do you get upfront price from a medical professional. Another thing with outcomes, like if I buy a car, right, I know that it will be a car driving me, and I know that if it will not be driving me, I can claim insurance and then get money back or another car. Now, how about healthcare? If they do an operation and you get worse, are they going to give you your money back? Yeah, it's funny, isn't it? No, they're not going to do anything at all. And for all these reasons, it's virtually impossible to have free market efficiently work on healthcare. It's almost never works. But there is this liberal approach, which is kind of in-between approach. Basic fairness, minimal health care, but also allow individual choice. So while some of it is open to choice, the basic care is provided necessarily. Justice as fairness, aiming to create minimal equality, may allow for inequality so long as the basic health care is assured. Right? So in that case, if you have money, you can pay for better care. But if you don't have money, you can at least get the basic care. That's kind of in-between approach. And then there is an approach which we can call socialism, although not sure if it is really socialism. We'll talk about socialism next time. Free access to universal health care for all people. There is positive right for health. Health is viewed as a basic good to which all people are entitled. What do you guys think? Which approach would you prefer? Okay, so based on the theory, which theory would you say that would be? That's also important to understand. Those are different approaches. One approach is to say it doesn't even matter whether it will make things happier or not. Everybody just has a basic right. Then we can say, well, if there's a person dying on the street, even if I may not benefit from the fact that this person is cured, it's just something fundamentally wrong with the fact itself. Utilitarian approach is different, right? You can make a different utilitarian argument about the same thing, and they say, well, people may not have a fundamental right to it, but everybody is better off this way as a result of us providing basic care. Now, why would that be a good argument? What do you think is the reason why everybody would be better off as a result of basic health care? Okay, yeah, it is in terms of like overall happiness increased because the happiness of certain people increased, and even though it doesn't increase your personal happiness, overall amount of happiness is higher. But actually, you can even make the case that it does increase everyone's happiness through several ways. In fact, in economics, they call it public versus private good, right? So what exactly is a public good? Public good is something which pretty much anybody benefits in some way. Like the public park is a private good because anybody can go there, even if you don't go there. But in terms of healthcare, there are several good arguments economists are making. One of them is not just sexually, transmittable diseases, right? Communicable diseases. If the person got communicable disease and is not cured, it can affect you. Even if you have very good health care, fantastic doctor, a lot of money, you catch horrible disease from that person, be it COVID-19 or there's even worse ones, right? That's not going to make you very happy, is it? So it is to your benefit to make sure that person is cured, because diseases pass from person to person, whether you want to or not, and whether they want to or not. Another problem which a lot of people pointed out, diseases are usually cheaper to treat if you catch it early, right? So if somebody goes to a doctor regularly, their disease will be treated early. If not, it can get to the point when it is extremely expensive for the society to treat it, and they are on the verge of death or something, and then because of the oath of Hippocrates and so on, people still have to, medical professionals still have to take care of them, right? But that is so much more expensive and so much less efficient. So the efficiency here is definitely lost. Plus the way it works in this country, there is a lot of money wasted on unnecessary bureaucracy surrounding the insurance claims and so on. And that again affects everybody, because your insurance is higher for all these reasons, right? You are not just paying for medical care. Your money don't just go to a doctor or nurse. They go to a bunch of bureaucrats and people who make profit, people who hold shares of those insurance companies and CEOs of those insurance companies, and like a whole bunch of other people involved in that business who do not provide any care whatsoever but make money on it, right? And as a result, that whole thing provides inefficiency. The system is very expensive. It's not to say that the socialist type of care is ideal either, but the simple reason there is that many people complain, well, the resources are limited. You simply cannot have a spare liver, for example, for every person who needs a liver. So there's only two ways to do it. Either financially, like the highest bidder, right, the person who can pay the most, and almost everybody agrees that seems outrageously unfair, or you have to wait in line. And then when it becomes available, you may get it or you may die before it happens. Same thing with all the other types of care, because obviously, ideally, you want to have a personal doctor per every person, right? And then every moment you need, you can just call them and go and see them. That would be fantastic, but then we need so many doctors, and obviously, you need to spend money to educate doctor, to prepare a doctor, to then you need to pay them for what they are doing, a fair compensation for that. And if we are going to, for example, have 100 million doctors in this country, who's going to pay for all that and how? Even if we have social type medicine, we would only have limited number of doctors. But at the very least, we could then calibrate how many doctors do we need, and you may have to still wait for your appointment or whatever, but you wouldn't have to pay for it. And another thing which also touches on this free market thing, it's almost impossible to know when and how sick you can get, right? That is completely unpredictable. Very few people, like sometimes genetically you may know you're predisposed for something. So even if you are completely healthy, does it mean that you will never need health care? If at the moment you are completely healthy, does it mean you will never in your life need health care? No, obviously not. You may need it tomorrow. Nobody knows when they're going to need it. So to take an approach like some people, oh, I'm healthy, why should I care? You should care because just like everybody else, you can get sick. And then you will need health care, right? So when people pay into pay taxes to provide for this type of universal health care, they're not just paying for other people. They're paying for themselves, even if they're not using it. So from that point of view, it makes sense. Again, it's not like buying a car, because some people can say, I don't want a car, I don't need a car, right? But with healthcare, nobody can say that. There's not a single live person who can confidently say, I will never need healthcare in my life. If they do, they are lying, because that's just impossible. So for all these reasons, definitely, at least either liberal or socialist approach are the best. Which one the best? There is a lot of arguments, but I think free market approach, it simply doesn't work. And any, like I said, any at least reasonable economist will tell you, because of the ways this specific good works, the healthcare, it's not suitable for free market distribution. It is not like other goods. Other goods like cars, but actually the same argument could be made about housing. Housing also is a little bit of a different type of good, because, well, we can get to this now with the, not now, but next time, with the economic justice. But in terms of housing, you may also say, well, why do I care if somebody's homeless? Why do I care if somebody has no home? Well, for many reasons, right? Even though you have a home and you're not personally affected by this, but the person sleeping next to your door, for example, would at the very least be a source of disturbance and inconvenience to you. And then this person may get so desperate that they may break into your house or something. That would be also a problem. So clearly, you cannot isolate yourself from this problem, and it is to your benefit to make sure that these people are housed at least somewhere. Okay, so health maximization, that's another thing we didn't mention. Public health is different from individual clinical care. Could be problematic, vaccinations, seatbelts, and so on. So in this case, to maximize healthcare, we may indeed need to have some strategies which in some cases may seem paternalistic, because with vaccination, for example, again, if you take this free market approach and say, well, if you want to vaccinate, vaccinate. If you don't, don't. But those are communicable diseases. And then children, parents taking this decision for their children. They decide not to vaccinate their child. Then their child gets sick, may even die, may infect other people. Does society have a right to then interfere and say to the parents, no, you have to vaccinate your children? It's not a matter of free choice, because first of all, you're making a decision for another living being, human being, not for yourself. And second, that decision affects other people. So health maximization sometimes can indeed interfere with this personal liberty and violate it seemingly. But it's a difficult choice, and different countries, different states approach it differently. Really, like in a democracy, I guess it depends on what do majority of people believe. But then the question becomes, how do majority of people believe what they believe? Where does their beliefs come from? And we will get to it a little bit later when we talk about Marx. So the last thing, measuring public health. Mortality rates can tell us something about public health in particular. If we look at the mortality rate, different populations, different countries, we can get some sort of idea. But that's not the best way too, because somebody can live very long life but be very miserable and sick their entire life, right? So there are such measures as quality of life, quality adjusted life years, and disability adjusted life years, where you get slightly better idea, not just plain number of years. But it still is difficult for many reasons to calculate that. Just some example. Let's say we have two societies, A and B. In society A, the situation is like this. 25% of people live past 80. 50% somewhere past 60, die in their 60s, but 25% die young. In society B, literally everyone lives around 65. Nobody any more, nobody any less. Which society is better? On one hand, the society B seems to have more equality, but at the same time, this equality comes at the expense of the 25% of people who do not live as long as they could, right? So the question there is greatest health or greatest number of people? If we go for greatest number of people, the second one does seem to be better. Greatest health? Well, not necessarily. So it is a difficult question. Obviously, you have to look more into like why is this happening? Why is there such separation? Ideally, you want everybody to live past 80, but whether it is achievable or not, that's a different question. And the chapter also mentions eugenics. That was really dreadful practice of creating good genes. Nazis were part of this, and it was even happening in the United States. There were forced sterilizations of certain people. About 60,000 people were sterilized. Crime committed in the name of public health. So basically, they were trying to decide who should and who should not have children. Some people shouldn't have children, so they were sterilizing them just to make sure that they don't. Of course, it does seem very, very unfair and unjust to us, but especially in the past, frequently, indeed, that was unfortunately taking place. Autonomy, in this case, should always be emphasized. Remember the Kant's approach, autonomy, treating people as the ends and not merely the means. Don't treat people as just like cattle or something. In this case, you cannot have the same approach. People should be given their choice. John Rawls, who we'll be talking about a little bit later, introduced the difference principle, allows for social inequalities as long as they help the least advantaged members of society, right? So that is kind of a more flexible approach, but Martha Nussbaum does argue against it. She says that in that case, you may still discount people with disabilities, not take them into consideration. It's a difficult topic. Good topic for a paper if you want to write paper on something like this. It is interesting. But today we're going to move to social justice in general. Another interesting topic, that is chapter 13 in the book. There's a quiz on it next week, not this week, but next week, but we are going to cover it today. So social justice. The question is of treatment, similar things in a similar way. Aristotle put it, similar things should be treated similarly. Example, students, right? If students have similar performance, they should get similar grades. If the grades are unfairly different, like If I start place favorites and give certain students good grades because I like how they look in a classroom or something, that would be unfair, right? That would be an example of unfair discrimination. Social justice is different from criminal justice because in criminal justice, the goal is obviously the punishment. It is more punishment-oriented. In social justice, there's no punishment. But it is just the broad social issues involving distribution of goods across large number of people. Moral approaches and conceptual issues. So first of all, there is a disagreement about social justice, which could be about the theory or about the facts. Remember, we did talk about it at the beginning of class. It's not the same thing. Some people may agree on a normative theory, but disagree about the facts. Does it actually work or not? So as example, affirmative action. We'll talk about it in the end of the lecture, but just to mention it right now. On one hand, you may disagree in terms of the facts of the case. You may agree that like the theory itself is, approach itself is good, but when you use this approach, the results are not good. So that would be more of a utilitarian principle, right? You can say that, well, you have good, something good in your heart, but once you start implementing it, the results are counterproductive. At the same time, you can take a different approach and go with more of a Kantian approach, deontological, and say, well, it's just the right thing to do. So it doesn't even matter whether it leads to good results or not. So that would be more of a question of theory than the facts. But then you can agree about the theory, but disagree about the facts in terms of utilitarian approach. Some people may say, facts show us that this actually works, that there are good results. And somebody else can say, no, that if you look at the different facts, you will see that it actually doesn't work. So this is the, something to keep in mind. Now, the principle of equality. At the core of all this principle of equality is, again, the idea that we should treat equal things in equal ways, and we may treat different things in unequal ways. Equality is the crucial idea of social justice. So what would be example of unfair and fair difference in treatment? Women in military, susceptibility to disease. So talking about women in military, the book gives good example that should you just increase number of women in the military without any regard for their ability to serve a particular role, like specifically in combat? Or, as some other people argue, should you put the same standard, right, of admission? And if the woman is capable of passing this standard, not lowering the standard, then she can serve, and if not, then she cannot. You see the difference, right? Because sometimes they deliberately lower the standard to allow certain categories of people in. Just so that, and the argument can be made why it's important to have different types of people, even in the military, even if they are unable to carry the same heavy load as somebody else. But other people say no, as long as these people can do exactly the same test, pass exactly the same test, then they should serve. Now, if you, on the other hand, just exclude women and say, we don't want any women in the military, whether or not they can pass the test, that seems unfair discrimination. In the same time, susceptibility to disease, that's a different case. If like certain types of people, like say certain races, have more susceptibility to disease, it's not unfair to, in this case, treat them differently in a sense that, for example, do more tests to figure out whether they have this disease, because it actually makes sense. Now, non-bias. The principle of equality is a principle of justice, and justice is supposed to be blind or non-biased. no one is favored over another. You know this famous statue of Justice? She has blindfold and holds the, what is it?
Scales.
Yeah, the scales. Exactly. So that's the idea. You have to try not to be blinded by prejudices and instead more fair and proportional in terms of your distribution. But that still has a lot of issues because when you start talking about it, when we talk more about the issues we have with us, there are past injustices and so on, which is harder to evaluate in this way. Can you really be blind to them or not? Or do you sometimes have to take a peek and see what exactly was happening? And then there's the idea of equity, which is distributed in different amounts depending on what people need or deserve in light of some relevant difference. So rather than equally dividing it amongst everybody, dividing it in some way, not as equally, but trying to balance certain other unfairnesses or problems. So there are, of course, social benefits and harms. The principle of equality directs us to consider the ways that social benefits and harms are distributed. And there could be two types of discrimination involved: primary and secondary. So primary discrimination is a person singled out and directly penalized, right? Somebody just doesn't want to hire women or something, right? And they see a woman applying for the job, they do not hire this woman. This is very direct primary type of discrimination. But secondary is more sneaky. In that case, there may be just some policies which are not even meant to be discriminatory, but they end up being discriminatory because of the way they end up working. Criteria chosen indirectly, but it does affect a certain group. It's tricky, right? Sometimes you really have to dig deeper to understand whether this specific practice is discriminatory or not. A primary discrimination is, of course, more straightforward and easier to figure out, but secondary is more sneaky. Proof and reality of indifference. The difference must be proven or shown to exist if we are to justify treating people differently. How can you prove it? Well, obviously, it's difficult, but in some cases, you can use statistics. Statistics can show you quite a lot. If you take statistics, especially higher level statistic classes, you'll see how it can be done. You can look at the numbers, you can figure out, and then see whether there is some cases of discrimination or not, what exactly are the reasons behind it. It can be figured out. Not always, but it is possible. Based on the fact or not opinion, nature versus nurture. So in other words, sometimes we may have a result not because it is nature, but because of the process of cultural practices. As an example, the book gives girls and boys. Somebody can say, well, look, girls prefer to play with toys and with dolls as toys, and boys prefer to play with guns, and they are more suitable to be soldiers. But then you can ask the question, is this because when they were growing up, their parents were giving them these specific toys and telling them, you are a girl, so you're supposed to play with this Barbie doll, and you're a boy, so here's the gun for you. And then as a result, of course, children grow up like this because, perhaps at the age of 5 or 6, they are not yet grown enough to make a choice themselves. But then it may seem like it is natural result, right? So you have to be careful about whether it is natural because like if you take a bunch of children away on an uninhabited island and then on that island put just one pile of dolls and one pile of guns and then observe them for a few years, And then you see that girls really prefer the dolls and the guy prefer the guns. Now that would be more pure experiment. Obviously we can't do it, unfortunately. But that would show to us that there is really some natural tendency. But when it's in a society and you grow with your parents and you grow with your friends and there is already some expectations involved, that of course doesn't work like this. Now actually, if you talk about ancient Greece, Greeks were also a little bit more traditionalist about the role of women. But there were Amazons. I don't know if you guys heard about Amazons. That was like the whole culture where women were actually in charge. And there are some historical accounts of that, so that is not made up. It actually did take place. And they were pretty good warriors. So even Greeks recognized that at least if the culture allows for it. Same thing with Spartans. Spartans actually made a big thing out of the equality between boys and girls. They were treating girls differently, not treating girls differently, treating them the same way as children. The girls and boys were fighting together. They were engaged in some sort of competitions. And because of that, again, if you do that, then girls do grow up to be more, in that sense, aggressive and closer to the way men are, or even maybe more so. Right? So that is the nurture versus nature kind of an argument. Because if you want to claim that this is natural, you really have to look deeper than just, well, this is what is happening in our culture. It may be happening in our culture and in some other culture, but it may not be natural at all. And differences relevant have to be relevant, right? Not only should the difference be proven, it must actually be relevant to the case where you want to treat people differently. Difference may be typical of a group as identity, but not belong to every member of the group. So here, something which we usually talk in Philosophy 102, different types of predication. There is collective and distributive predication. And it's important not to mix them up. What does it exactly mean? So distributive predication is something like this. Fleas are small, right? Fleas are small. How do you know if fleas are small? You have to look at the individual fleas, right? And then you can, after looking at individual fleas, determine whether all the fleas are small or not. That's called distributive predication. It belongs to every single flea. A different example would be something like this. Fleas are numerous. Now, can you look at an individual flea and figure out whether the flea is numerous? No. You can only look at the entire class of fleas, and if there's a lot of them, then they're numerous. So that would be collective predication. So in many cases, people do not distinguish these types of predication, and then they try to, for example, talk about something which only belongs to the class and apply it to individuals, or the other way around. So one example would be a guild. Can guilt be collective property? Can you say this nation is guilty? Yeah, exactly. Because guilt is an individual quality. Individual can be guilty. Or not. Depends on what? Your actions. You cannot put a blame on the entire nation, like let's say Germans during World War II, because there are different individuals, different circumstances. You cannot blame all the people just because they are Germans for the atrocities committed by other Germans. Even if a lot of Germans committed atrocity, not everybody. And even the ones who committed them, in some cases, may have been forced, coerced into this, and brainwashed into this, right? So that is not the type of collective predication. It is, in terms of guilt, you can only talk about individual guilt. Individuals are responsible for their actions. At least that's what we always presume, right? Because otherwise we cannot really blame anybody for anything. Okay. So racism and unjustified discrimination. Of course, racism is the most outrageous type of discrimination. The basic definition of discrimination tells us that to discriminate is to distinguish between things, usually in ways that simply imply judgments about what is better or worse. So not all discrimination is wrong. When people hear the word discrimination, they immediately think this is something wrong. Well, it depends. Discrimination is about making either good or bad judgments. For example, soldiers must discriminate between combatants and non-combatants, right, in a battle. Why? Well, because according to the rules of war, you cannot hurt the non-combatants. You have to spare the civilian population. If you're fighting, you can fight against other fighters. You cannot fight against population. Unless, of course, the population also is engaged in military action. Right? If somebody is a civilian but has a machine gun and tries to kill you, then obviously they are no longer civilian. But if they are going through their daily routine, I don't know, taking care of their children, and you are killing them, then you committing a war crime. That is unacceptable. So for this reason, soldiers have to discriminate. They have to actually look at people and decide, is it a combatant or not? And if it is a combatant, I have a right to kill them or hurt them. But if not, then I do not have this right. So that is also a type of discrimination, but that obviously is not unjust. Now, back to racism. So racism, unfortunately, is still a huge problem in this country and in other countries. The examples of unjustified discrimination would include on the basis of race, ethnicity, gender, sexual orientation, religion, age, or even ability. Now, Civil Rights Act of 1964 did explicitly state that its goal is to provide relief from discrimination, to prevent discrimination in public and federally funded programs and institutions. Note that it actually says public and federally funded programs and institutions. It's much harder to deal with it in private sector. But at least for the public purposes, they did it. Later on, they passed more legislation, which was also meant to cover as much as possible. Now, racism is a type of unjust discrimination. Racial discrimination occurs when there is unjust differential treatment given to someone based on their racial identity. Let's immediately ask, why do you think it's unfair? Hopefully you agree it's unfair. Why is it unfair? Yeah, it's not a relevant difference. That's the thing. Like, you should not discriminate people based on the color of their skin. This is, to put it bluntly, stupid. But it also is hurtful, because it hurts these people and it hurts you. Again, that is one of those things which kind of a two-way street. It affects everybody. It definitely increases tension within society. If some people feel they've been unfairly treated, it affects everybody. It doesn't just affect them. So that is the obvious, seemingly obvious reasons. But remember that frequently that the way it works is based on this cultural upbringing, based on some even subconscious reactions which people have to strangers, to people who do not look like them. And this is the difficult part about it, because hopefully there are very few people in this country who consciously thinking, I'm a racist and I want to discriminate. But there are many people who don't realize that. They think that they actually are making smart choices. I only hire white people because they work better. And then they actually discriminate unfairly, right? When, of course, what would be the correct approach? If a candidate comes for the job, look at the candidate. Evaluate them based on their ability. See whether or not they are indeed capable to do this job better than other candidates. And that's how decisions should be made. That relevant difference would be ability to perform the job, if we're talking about job market. And that's the only thing which should matter. Obviously, race shouldn't matter at all. It should not even be a factor. But one of the things which complicates this issue is obviously that is a historical problem. The problem goes back to the times of slavery, right? Many people who have been wronged at the time had children and the grandchildren who grew up now. And there is this kind of the effect of the past discrimination, which still may be present in the society, resulting in the fact that there's a lot of statistics about how, for example, African Americans have, as a result, are in the lower income group of the society and so on. So then there's been efforts to kind of counter it, affirmative action and so on. So that is one of those things which is very controversial, because a lot of people feel this is a type of reverse discrimination. It also discriminates, but against white people in this case. So a couple of things which the book mentions. Critical philosophy of race. Critical philosophy of race just evaluates racial categories and questions whether or not race is a biological fact or a social construction. I don't know if you read the book, but what do you think? Is it biological or is it a social construction, the race? Exactly, yeah, that is, well, it's in the chapter, which is why I was saying, like, if you did read the chapter does go over this. So yeah, that's the conclusion most experts today have drawn. It's a social construction. There's really no biological fact about a race. There's practically nothing you can determine. In terms of DNA, people are pretty much the same. DNA, when you check the DNA, you can discover where this specific type of DNA in what part of the world it's more prevalent, but it tells you nothing about things like race and so on. That is not something which you would see from the DNA. DNAs are almost identical in that sense. So there's really no biological fact to support that. Culturally, of course, there are differences. It is a social construction. And then there is the critical race theory, which has been banned on a number of states today, which basically focuses on the critique of the way race, racism, and racial privilege were manifest in the legal system in the United States. Cornel West, in particular, argues that critical race theory is a comprehensive movement in thought and life that critiques white supremacy. Now, like I said, certain states banned critical race theory because they think it promotes the feelings against white people in particular. In Florida, Ron DeSantis claimed to have ended wokeness by banning critical race theory. But any critical approach, including to race theory, is not a bad thing. It's useful to question those things which we take for granted, right? You may agree or disagree, but it's never a bad thing to question something. If you stop questioning, you become dogmatic and you basically just then repeating dogmas. So I don't think anything should be banned. It's always useful, it's always good, even if, like I said, you may disagree with the conclusions. That's part of the critical approach. Or you may agree with them. And in particular, in this country, obviously, there are problems with the way people are reacting to different differences in race and so on. So a couple of other things book mentions. 1619 project by Nicole Hannah-Jones claimed that slavery was central to the founding and subsequent history of the United States. But in response to this, now the Trump administration came up with 1776 project, which has this alternative history, trying to kind of disprove it. And lots of things have been done now by Trump administration to basically just completely demolish the entire thing and change the museums in Washington, D.C., replace the exhibits, and kind of try to spin it all in a very different way. Well, history in general obviously has a lot of facts, and if you selectively pick some of them, you can prove almost anything you want. But that's not a fair approach to history. Certain things in history definitely should not be overlooked, and the racism is definitely one of them. Race, like I said, and that is more or less a conclusion, is not a biological category. It is a social construct. The journal Science in 2021 explained that human genetics have mostly abandoned, geneticists have mostly abandoned the word race when describing populations. Current scientific understanding that race is a social construct. Now, race is a category that was made up for social purposes. It tracks very, very minor differences in genes or biology. But people do think these kinds of things deliberately. We'll talk more about it when we talk about Marx, but that basically is one of those ways which could be used to create a certain ideology. It's an ideological feature. Now, there are a number of researchers who the book mentions. W.E.B. Du Bois was one of the first. It was like more than 100 years ago. He worked, he said that the race is a social, historical, and spiritual entity connected to language and traditions. So language and traditions are a lot more important in that sense. Obviously, people who share language and live together and have similar traditions, they do start thinking more similarly and acting more similarly. But that doesn't mean that that has anything to do with their race or some other genetic qualities. Then Kwame Anthony Appiah said that the idea of firm and essential differences among races is false. He calls this idea racialism. Racialism. But there's actually some arguments made against it. For example, Lucius Outlaw Jr. said that races is genetically different. Cultural, historical, and biological groupings should not be denied, and he argued that oppressed groups should affirm their racial identity, not deny it. Why did he think that it should be affirmed, not denied? Because he thought that's another way maybe of discriminating people by just telling them, oh no, like I don't even see any color. I don't know what color anybody is, and neither should you. So he thinks that it actually weakens the case for people who are sharing the same race. They should bond together in order to counter the discrimination. Well, obviously that there is some disagreement on that subject. It's an interesting subject. So racism makes a significant factor of race in unjust treatment of people, distinguishes between groups of people so as to lead to unequal, oppressive, and hierarchical treatment. Now you can criticize it from the point of view of all the theories we covered. For example, from Kantian perspective, you can say that it violates autonomy and treats people as means rather than the ends. So that would be Kantian approach. If you start discriminating people based on their race, you are not treating them as the end in themselves. You are taking away their autonomy. Utilitarian perspective would emphasize the consequences. It would say it produces harm and unhappiness, right? So then you can say, okay, regardless of whether or not there is some principle behind it, it just makes society less happy because people who are discriminated against obviously would not be very happy about it, but even people who discriminate, to them it still does certain harm because it creates tension. If somebody else is extremely unhappy, that can affect you. How can it affect you if somebody else is extremely unhappy? Can you think of any example? In terms of race specific. Let me give you one example. Riots. Why do riots happen? Because of the discrimination. But if the riot happens, does it affect people who are not of a certain race? Like, yeah, obviously. Their cars can be damaged, their businesses, they themselves can get hurt. So clearly, if some people are unhappy, it can affect other people. You cannot possibly isolate it and say, okay, well, we will keep them at bay somehow. It's impossible. We are living in society, everybody is connected. So naturally, if some people are unhappy, they react to that, and then that can affect everybody. And then natural law principle. From the natural law perspective, you can say it violates inherent dignity of all human beings. Remember, natural law, you are actually then assuming that there is such thing as humanity and some inherent principles, and that seems to violate these inherent principles. Because, well, I don't know, from any perspective, it doesn't seem like there should be any difference between human beings. It does seem to be contradicting any religion. I don't know if there's a religion which says that human beings, well, at least not in a racial way. I'm not aware of any religion saying anything racist against other races. Their religion typically goes about infidels, people who do not share your beliefs, but not against other races. Okay, structural racism and implicit bias. So structural racism is the subtle system of organization that produces desperate social opportunities and outcomes for different racial groups. It's always possible that society does have certain structural racism. In some cases, it could be explained by other reasons, right? Efficiency or whatever. But in reality, if you dig deep enough, you can figure out that that may be racist in essence. Implicit bias, on the other hand, is the bias that is often unconscious. So people may not be aware of the fact that they are racist, but still have this bias against different race. So somebody interviewing 5 people for the job, like one of them is black or something, and they honestly think that this is not somebody fitted for this job, when in fact they just been racist about it, right? So that would be kind of hard to pin, but nonetheless could be present. Now, intersectionality is something which Kimberly Crenshaw came up with. That's the multiple system of subordination or compound discrimination, multiple burdens, double or triple discrimination, which occurs in different ways, includes an intersection of race, gender, sexual orientation, religion, ability, age, and geography. It's an interesting concept. It also tries to kind of explain how racism can work in a variety of different ways. Now, another subject to mention is police brutality and Black Lives Matter. Obviously, that's a big problem in this country. We have problem with police unfairly treating individuals of especially African American, right? And that is, the book provides some numbers. That is a fact. For example, it talks about how black drivers are 78% more likely to be stopped than white drivers. And then at the same time, white drivers end up being in possession of something illegal 45% more. So in other words, you can clearly see from the results that it seems like they just unfairly stopping somebody, even though the results show that this is not the kind of demographic they should be concentrating on. So there's probably some implicit bias present. That's the type of racial profiling when police engages certain individuals just because of their race. It should not be happening, but it's very difficult to, again, root it out, because clearly police may always argue that, no, that's not because of the race. We have different reasons. It's just from statistics you can see that it happens so often that it cannot be for different reasons. But in each individual case, it's hard to pin it down, unless they tell you point blank, I stopped you because you are black, and they will never do that. It's almost impossible to confront them about that. Civil rights. So rights that are granted by the government, including right of citizenship. That's an interesting thing in this country, because initially America conceived of civil rights just for free white men. There was no civil rights for women or for different minorities. Several categories were deliberately, intentionally excluded. Now, interestingly, we moved past that, but here's another interesting debate to mention. Citizens versus non-citizens, which came up recently. Should non-citizens be treated differently? Should they not have the same rights as citizens? Because the argument made is that since they're here illegally, especially for those who are illegal, well, there obviously are non-citizens who are here legally. But let's say somebody is here illegally. Should they not be protected by the law? Yeah, it seems common sense. I don't know how you can argue otherwise. Like, it still is a human being. And the fact that they entered the country illegally does mean they violated the law. But even people who violated the law still are protected by the laws. There's no option where you can exclude somebody from the legal protections. In particular, though, things like search, the entry of the residence, and so on. It does seem strange that many people who otherwise advocate freedom and so on don't see any problem with the ICE agents entering homes without a warrant. So they basically just break the door, take whoever's inside, and pull them out without George involved in any part of this process. This seems like a violation of everybody's rights, because then as a result, some of these people actually end up being US citizens. But even if they were not US citizens, what do you think about this whole concept that only citizens should have certain rights? Do you guys agree with that? Yeah, that's the question, right? Are those people actually criminals, or are they just criminals because they came here illegally? Because there are people who are murderers and robbers. They are definitely criminals. But if the only crime they committed is they crossed the border without getting a stamp in their passport, is this really the kind of crime when you have to take away their other rights and so on? By the way, yeah, like, well, we're wrapping up in a moment, but just one more thing to mention. This country was open to all immigrants prior to 1920s. They actually, that's why the Statue of Liberty says, give me your hungry, your poor. Anybody could come here. There was no immigration enforcement whatsoever. You could just get a ticket, cross the ocean, and you come here, you can live here. Then after the World War I, they introduced this system when they started kind of preventing people unless they get special authorization. Now, whether it is the right approach or not can be questioned by itself. I mean, on one hand, of course, you don't want to open the border and have 1 billion people come here. On the other hand, if somebody is already here, should you deport them then? Should you go through all these troubles to get them out of the country or not? Well, clearly, some people think you should, some people think you should not. Okay, we're going to finish next time, I guess. There's still a couple of issues here, and talk about economic justice. So this, like I said, this quiz is next week, but I do want you to read the chapter. And there is a reading on Marx, which I already uploaded. We'll talk about Marx next week.